What's up, guys? This is John from New Boston and Portsmouth Clinics here at Tri-State. And today we're just going to go over a little bit about what blood flow restriction is, how we can use it in the clinic. Really useful technique that we just got certified in. I know Dave's been using it in Ironton with some of the booty flossing and stuff like that. But this is the more accurate way of doing it, the safer way of doing it. Joe, Wes, and I went to this course down in Lexington down in January, and we've been using these techniques down in Portsmouth and New Boston quite often. We're getting some really good benefits with it. So what we'll do today is I'll go over a little bit. I'll just kind of briefly touch the highlights of it. I'm not going to go too in depth today for your purposes. I've got a whole book full of stuff, so if you have any additional questions, you can just get a hold of me. But basically what we're going to do today, I'm just going to give you a little bit of an outline, and then I'm going to post 2 videos on how to find the limb occlusion pressure, which we'll go over here in a little bit. There's one for the upper extremity. There's an upper extremity video and a lower extremity video. So what we're going to do first, I'm just going to explain what BFR is, how we can use it, some of the positive effects that we're getting clinically with it, and then after that I'll get into like a little bit of a lab part, and then I'll post a couple questions just to make sure you guys understand what we're talking about. So just as a quick introduction of what blood flow restriction is we are occluding blood flow to a limb, and that's going to give a cascade of events that can positively change the structure and the function of a leg or an arm, depending on what kind of the injury it is. It's also called occlusion training or hypoxic training, depending on what doctrine you look at, what kind of research you're diving into. It's called a couple of different things. So if you see anything of that nature, it's basically talking about the same stuff. We use BFR to increase strength, attenuate atrophy. We could actually cause hypertrophy with our athletes or our patients. It's effective in both prehab and rehab with our physical therapy treatments with our BFR, which makes it so useful. It can aid in recovery. It can also improve cardiac function, which we'll get into here in a little bit, and it can also reduce pain. The origin of BFR, it started in Japan in the 1960s. They used it with their militaries and stuff like that. And the United States caught wind of it. They started experimenting within the military back in 2011. So ever since then, it's kind of leaked into sports science, and we're using it more in therapy. You look at your NBA, your NFL teams; they're using BFR too. So it's spreading pretty rapidly, and it's a really useful technique, and people are getting some really good results with it. So how does BFR work? Kind of diving straight into the physiology. Not going to get too in depth. The guys there were super smart, and they were talking over my head quite a bit, so I'll try not to do that too much. But basically, just to keep it simple, what we're going to do is we're going to decrease the arterial flow within a limb, and that's going to cause some cellular swelling, which activates some of the metabolites such as lactate, which has a direct correlation with growth hormone production, which obviously can kind of help grow and promote atrophy within a limb. The hypoxic environment, within a limb changes the energy uptake from the aerobic systems like the Krebs cycle, and it changes the aerobic systems to an anaerobic system via the Cori cycle for ATP production. And what that's going to do is that's going to improve the recruitment of the larger fast twitch muscle fibers, the type 2s, which have the greatest capacity for growth and hypertrophy within a limb. So once again, talking about improving strength, improving size of a muscle within a patient, and it can really help our patients out. Also, it promotes capillary growth and bone phosphate uptake, so that can really help with bone mineral density for some of our elderly patients. So that kind of increases some of the patient population that we can use this with. It's not just our elite athletes, it's not just our post-op people, but we could also use this with some of our elderly people too. So it's a very inclusive technique that we can use for just about anyone using the different modes of this. We briefly talked about the cardiovascular effects of it. How that works is it's going to reduce the blood flow due to the venous occlusion within a limb. That's going to decrease the stroke volume with each heartbeat, which is going to cause an increase in heart rate to maintain the blood oxygen required to maintain your exercise. So basically what that's going to do is that's going to positively train the heart with less stressor time. It's going to get that heart rate up with less stressor time demands on the heart. So we can positively train the cardiovascular effects within the body too with using these blood flow restriction techniques. So basically, what we can do, we have little tourniquets that we put on either an arm or a leg. The first thing that you have to do is you have to find the limb occlusion pressure within each limb. The limb occlusion pressure is just the minimum amount of pressure needed to occlude arterial blood flow in order to get the desired effect of what we're talking about here. We use the radial artery at the wrist. Sorry, the phone's ringing at Tri-State. We use the radial artery at the wrist with our pressure, and then we use the posterior tibial artery. I'll post videos on how to find both of those after this in the lab videos. Depending on what body part we're treating, there's two different ways of doing this. The first way to do this is just to find the limb occlusion pressure and do like a level 1 technique, and I'll get into the different levels here. We'll do a level 1 technique with all of our bedridden patients, our non-weight bearing patients, where we just inflate the cuff all the way to 100% of the limb occlusion pressure. It's called ischemic preconditioning or cellular swelling techniques. Basically, say you have a fracture, a femur fracture, you're non-weight bearing. What you could do is you could apply the tourniquet to the affected leg, and you can inflate the cuff all the way to 100% of their limb occlusion pressure, which once again, I'll show you that here in a second. The first thing that you can do is do nothing else. You could place the tourniquet on, inflate it all the way to 100% of the limb occlusion pressure, leave it on for 5 minutes, come back in 5 minutes, take it off, or just deflate the cuff, leave it off for 3, and then go off and on. 5 minutes on, 3 minutes off, 5 minutes on, 3 minutes off. You can do that for 5 rounds. Talk about a positive effect that you can do without spending much time with the patient. If you're trying to multitask, see 3-4 patients at a time, this is a really easy way to do it. Once again, this is going to improve the hypertrophy of the muscle by promoting the growth hormone within the limb and stuff like that. There's all kinds of good studies out there that I have in the booklet if you want to dive into some research with that to see the positive effects of that. It's a great technique for that. So once again, that's called ischemic preconditioning. That's for our level 1 patients. This will help preserve muscle mass. We talked about our post-op patients, bed rest, prolonged bracing. It's also good for improving bone mineral density and function and improving muscle size and strength. So that's just the ischemic preconditioning part. When we use these techniques with our athletes, we usually use this as a level 2. So basically, our level 2 technique with blood flow restriction, you're going to put the tourniquet on, find the limb occlusion pressure. You're going to inflate the cuff to about 50% for the arm and 80% for the leg. So say the limb occlusion pressure for an arm is 120, you're going to inflate the cuff to about 60, and then you're going to have them do the desired exercise that you're wanting to do with them. Same thing for the leg. Say the limb occlusion pressure is 200, just to make math easy. You're going to inflate it up to about 160 and then have them do the whatever exercise you want to do to promote the healing process. So with that, the protocol for repetitions and stuff like that, it's pretty easy. What they want you to do for our level 2 techniques, they want you to do like a priming set of 30. So apply the tourniquet, put as much pressure as you want according to the LOP, whether it's an arm or a leg. They want you to do 30 reps of a desired exercise. The key is not to just do it super fast, do it in a slow, controlled manner. They want you to do a priming set of 30 reps and then take a 30-second break and then do 3 working sets of 15 of the same exercise. So if you want to work on quad strength, you could do like a straight leg raise, or some of our higher level patients, you could do like a weighted sit to stand, or whatever the case is. Same thing for an arm. If you wanted to work on rotator cuff strength, you could do resisted theraband, external rotation. So depending on what activity, what muscle group you're wanting to train, what kind of injury that you're dealing with, you can do either way. So once again, our level 2 techniques, you're applying the tourniquet, 50% limb occlusion pressure for an arm, 80% for the leg. You're doing a priming set of 30 reps followed by 3 working sets of 15. It's very, very tiring, So really de-weight the exercise, whatever you're doing. Let them do a very manageable weight, because it will start to burn them up a little bit. So basically that's the thing, and you can get creative with this. There's no specific protocol for what exercises or what not to do. We usually do 2 to 3 exercises with the BFR at a time. The class said that you could do up to 6 or 7 exercises, so depending on the patient, depending on what you're trying to get done, you could do a number of different things. You can get kind of creative with this. It's a really safe technique. There's really no side effects. You can get some numbness or tingling in the limb if it's too tight or whatever. But it's a really safe technique, especially if you do it scientifically with the limb occlusion pressures versus the voodoo flossing and stuff like that. So that's basically the procedure of it. We went over the physiology of it. There's a few contraindications. The class told us not to do BFR with anyone with cancer. No BFR with any extremity with a dialysis port, excessive postoperative swelling, severe hypertension, if there's a known clotting risk with a medication, if they have anemia, if they have a crush injury or acidosis. Those are some of the most common contraindications that we might run across in the clinic. There's a whole list of them. If you want those provided to you, just let me know and I can fax those up to your clinic. So basically, that's about it. We talked about why it's used, how it's used, what kind of patient population it's used for. Just to kind of wrap things up, like I said, we're occluding some of the blood flow, which is then going to promote a higher rate of motor unit recruitment within each muscle belly. It really helps the promotion of hypertrophy and muscle gain. You can use it with just about any type of patient, whether it's a post-operative patient that's non-weight bearing to a high-level athlete to even some of our elderly people. We've even put the cuffs on both legs and had patients just walk on a treadmill just to kind of promote that bone mineral density. So once again, it's a really useful technique. I hope you guys learned a lot. What I will do is I will post how to find those limb occlusion pressures in the next couple videos. And then hopefully you guys, if you guys have access to these cuffs, hopefully you guys can start using them within your practice, because I really think that it's a beneficial technique. So next what we'll do is I will show you some ways to find the upper and lower extremity limb occlusion pressures.